Good afternoon. Welcome to this special GMC membership meeting info session. I'm Greg Marcus, chair of the GMC and president and CEO of Marcus Corporation. Thank you to all who could join on such short notice, especially today's guest speakers, Lad Wiley and Bo Sutton from Epic Systems. As you look for tools to assist in the upcoming regulatory changes, we've invited Lad and Bo to share how Epic is partnering with organizations on a vaccine credential tool. Yesterday morning, they released a statement announcing the new tool designed to give individuals an easier way of showing their vaccine status if they choose. And we thought it'd be useful for our membership if they could join us today to explain the tool's functionality and provide information on how you can participate in the regional rollout in Milwaukee. The documents we shared with you yesterday state, Epic provides vaccine credentials to give an individual the choice to show proof of COVID-19 vaccination or COVID-19 lab results. A vaccine credential, similar to a paper CDC vaccination card, binds an individual's identity, their name and date of birth, with information about COVID-19 vaccinations or last COVID-19 lab result. Unlike a paper CDC card, vaccine credentials can be represented as machine-readable QR codes or files, which are then digitally signed to prevent tampering. The credentials only contain the information required to verify vaccination or test results. The choice of how and when to share that information is left up to the individual. Our goal is to get back in person in the safest and most efficient way possible. I invite Lad and Bo to share how Epic's credential tool will be beneficial to your organization in our region. We'll have time for Q&A at the end and ask that you use the Q&A box to submit your questions. And as I welcome Lad and Bo, we were talking beforehand, and Lad's, was speaking about our virtual world, and yet I sense he's committed to ending our virtual world as best we can. So with that, Lad and Bo, go ahead.
Okay, Greg, thank you very much for that kind introduction, and Julia and her team for inviting us to participate in this meeting today. As Greg indicated, Bo and I are with Epic Systems over in Verona, and we are part of a new public policy team that Epic has launched about a year ago, and our goal is to engage and collaborate in our community here in Wisconsin, as well as in Washington, D.C. and state capitals around the country in terms of discussion of important public policy issues. As Greg indicated, yesterday we announced the availability of a vaccine credential that can be made available through an individual's MyChart. And the purpose of the credential is to give an individual the ability to show proof of COVID-19 vaccination or lab results. So it's both whether or not you've been vaccinated or a recent lab result. And we have been working on this credential for the last 6 to 8 months, and are now gradually rolling it out throughout the Epic community, really over the next 6 months or so. It is a software update that will be made available to our customers across the country. There are approximately 100 million MyChart users across the country, and we're really pleased that Wisconsin has a number of early adopters of the credential. And so we are expecting before the end of the year to have widespread adoption throughout the Wisconsin Epic community. For the work that we do, our software is made available to our customers, health system customers, and then they are the organizations that make the software available, in this instance, the vaccine credentials available. Right now in Wisconsin, There are a number of organizations that are live with a credential. In the Milwaukee area, it is Advocate Aurora, Freightert, and Pro Health. And in the Madison area, it is GHC, SSM, Dean, Unity Point, and shortly University of Wisconsin, UW Health. And I am going to stop for a minute and turn it over to my colleague, Bo, who will describe how the credential works and what the potential use cases might be. Before I do that, our strategy in rolling out this credential, we think that it will be really helpful. As a company, we are a healthcare company first. We really believe the pathway out of this pandemic is through the vaccine. We are a fully vaccinated company as of October 1. All of our employees are required to be vaccinated. And Bo will walk through some of the use cases. As our thought is, we've rolled this credential out in the health policy media in Washington, and then really are trying to take a careful regional approach because we want there to be, number one, widespread availability of the vaccine in the regions as we launch the credential, as we launch it. And number two, we're really looking for good use cases so people can understand, patients can understand where could I use it. The last thing I would say before I turn it over to Bo is we understand that this is not a Epic only solution. So, and Bo will talk about this in a minute, but we designed the credential to a national standard so that it is not just Epic organizations that are making this credential available, but other health IT vendors are designing to the same standard. And our hope is that that will make it easier for businesses and individuals to use the credential. Also, we understand that not everyone has access to a smartphone, and Bo will be describing some of the ways that we have tried to make the credential available for those that don't have access to either a smartphone or don't have MyChart through their healthcare provider. So with that, Bo, I will turn it over to you.
Thank you, Len. So some additional details on the credential. The way that vaccine credential is produced in Epic is that a health system has a patient and they have a patient record in Epic. And when that patient record is there, they have the ability to have a patient portal, MyChart, that they can access that health data from. There are a few ways that the vaccine credential can be produced. The vaccine credential is a QR code that is machine readable, as Lad said. It can also give additional details in a human readable format, such as the date of vaccination and the type of vaccination received. One of the issues that a lot of folks have had is that they don't have access or they lose their card, they got vaccinated in different places, et cetera. And so what we've tried to do is create a way that no matter what situation you got your vaccination in, you're able to get a vaccine credential as long as you can provide proof. And so the ways to provide proof are, in the state of Wisconsin, our healthcare organizations are connected to the state immunization registry. And so if I'm a patient and I got vaccinated at a location like Walgreens or CVS that isn't my healthcare provider, I'm able to actually, in MyChart from that app, query the state immunization record, and they're able to confirm that I got a vaccination And I confirm it, and then that is in my patient record and in my chart, so that I'm able to produce that QR code. The other, if for some reason, and there are a few organizations that don't connect to that state immunization registry, so if I got vaccinated maybe at a VA facility in a different state, I am able to also upload my card and have a provider confirm that it's accurate, so that they can do that manual confirmation, add it to my patient record, and then I'll be able to produce a QR code. So the thought there being, once I have that in my patient record and I'm able to produce a QR code, we need to be able to then have folks be able to confirm that it's accurate, that it's there. And so there are apps that have been developed, not by Epic, but by the Commons Project, that standards group that Lad referenced, that are free and available at the App Store, that can scan the QR code. And it does a few things when it scans the QR code. One, says, gives the details behind it. This person is vaccinated, that the information in there is accurate, so it shows that. And two, it confirms that the organization that produced the QR code is a verified entity. So what that means is the VCI, that Vaccine Credential Group, that is the standards-based organization that we coded to, also has a directory of organizations that are trusted, healthcare providers, states, et cetera, so that the folks who are ingesting that QR code, that are reading it, are able to know that the person who produced it is someone that they can trust. And that's the other thing that the app does. It confirms that where the QR code is generated from is accurate, and it'll produce truly a green light saying that the information there is trusted. Lad also mentioned a few different use cases. We think there are both internal, so organizations, and external use cases for this. Internally, you're able to do either scan directly if you are requiring vaccinations for certain roles to confirm that your employees have. They are also able to actually create a export of the QR code and the data in there and send it in, so that if you want to collect it for an HR system or for proof, and someone doesn't have their paper card anymore, or you want to make sure that you have an extra level of security on what's being submitted, it is a way for them to submit that proof of vaccination. Externally facing, what we've seen, we started to see organizations do, and we have a number of pilots going live in October, is that they're going to, for example, at the Overture Center in Madison, they're going to provide an option to scan your QR code as you come in with your ticket at their 100% vaccinated events. For those, one note, because not everyone does have access to either a MyChart account, or another organization that produces this QR code, we do believe that there will always need, at least at the time being, there will need to be another line for folks to confirm via paper card or another way. But to Lad's point, we also want to design with equity in mind. And so if I don't have a smartphone, or don't have MyChart, but I do want to get a QR code, I can actually ask my provider to print it off for me, or go to a library and sign online and access computer there and access my MyChart and then print off the QR code. So it is possible and enabled that these can be printed off so that QR code is scannable from a sheet of paper. I know there was a lot of information there. Lad, anything that you would add?
I think that gives a good preliminary summary, but Bo, thank you. And we'd be, very open to questions. Our thought is, before doing a widespread launch in any particular community, to have conversations like this with potential use case scenarios, and give a chance for people to react. We are moving forward with this in a sensitive way. We know that not everyone is excited about having to show proof of vaccination, and that not every business plans to do it. So this is very much of an optional project. I would say there are three states that have done mandates, New York, Louisiana, and California. We have designed our credential according to the same standards that those states are using. We're currently working with the state of New York and New York City for them to recognize our providers as a trusted source. We're making good progress there. And we believe in the next couple of weeks, New York will start to accept Epic credentials as proof of vaccination, so that, you know, no matter where you are in the country, if you're visiting New York, that our credentials will work to get into a restaurant there. Similarly, Louisiana, that is the case, as is California. And we've seen a specific example of the San Francisco bars. There's a San Francisco Bar Owner Association that is checking to the standards that we've used, and that seems to be going well. As Bo said, here in Madison, the Overture Center is going to be using it. Our own Chamber of Commerce is going to be using it to reopen their offices to a fully vaccinated group. And then for their events, the events that they sponsor, they will be vaccinated only. And the credential will be one of the ways in which they confirm vaccination status. And then also the Sylvie, which is one of the performing arts or music venues here in Madison, is accepting the credential via MyChart as proof of vaccination for their vaccination only events. So with that, I'll go on pause, and Julia, happy, and Heather, happy to answer any questions from your membership.
And Lad, it looks like we did get one question from Mike. And Mike asked, is there any reason why the card cannot be shared to the Apple Wallet and people need to download third-party wallets? A two-part answer to that. One is, you don't need a wallet. You can do it directly from MyChart. It'll produce there and you can take a picture. But also, Apple, with their new iOS release, is actually going to, that they're releasing this month, and they just did their event on, is allowing the vaccine cards to be uploaded to their wallet. And what's nice, we've actually worked with them so that there's an export button on MyChart, in MyChart, with your QR code. So you hit export and it can go directly to that Apple Wallet and be uploaded to be available both when you're online and offline. So the thought being, even if it doesn't happen directly from Epic, we want to make sure that folks can get it as many ways as possible. And so the Apple MyChart, or the Apple Wallet, will be an option shortly.
Yeah, in fact, Bo and I have been closely working with Apple's public affairs group, and the goal is meet a national standard, be interoperable, and help users be able to access it any way that they want to. Next, there's a question: do you see any application for this for employers in the vaccine mandate? We do, and employers are obviously going to make their own decision as to how they could use it. But one of the things that this would allow them, an individual, to do is upload a file, basically send it to their employer to show proof of vaccination, or the employer could have a reader app and ask employees to stop by and present the credentials. So they could either an employee patient could either electronically upload it and send it, or physically show it to their employer.
And Lad, we have another question. Is Epic considering, we're working on a tool that would help employers track track vac status of their employee base and collect weekly testing for those opting to test weekly. Right now, we're not doing that. It tends to fall a little bit outside of our area of expertise to do more HR tracking. And so that at least is not currently in my plans, unless Lad, you've heard something differently.
Correct. Okay, so for right now, we don't see any additional questions. One thing that I would say is we are eager to find some use cases. We'd like to work with our provider community in Milwaukee at a time they feel comfortable to communicate the availability of the vaccine credential more broadly. But one of the things we're hoping to do is find venues or places where it might be used, so that, you know, a consumer or patient can understand, okay, this is, you know, this is how we would use it. We are also engaged in talking with some national organizations about, you know, sort of broader venues where it could be used, and don't have anything to report on there. But our sense is that we're going to start to see, you know, sort of national organizations indicating that they're going to have vaccinated only venues, and we're trying for this to be an option that they would use.
I have a quick question with that, related to that. Have you guys built a system that says, so now venue XYZ says our show is going to be vaccinated, or our conference is going to be vaccinated? So show up with your Epic Pass or whatever. I just stole it from Vail, I guess, but show up with your Epic Pass to get in. Here's a link to actually show you what to do. I mean, have you built that piece of functionality, and so that there are a bunch of people showing up unprepared?
That's a great question. And that was actually when we started working with some of our initial pilot groups, a request. And so our team has put together a short video on YouTube, actually, that can be linked out, that shows patients how to access it. That goes step by step of how do I actually get this. The plan, at least for the groups that are using it now, is to put in their FAQs, so that, or associated with an email that goes out with a ticket, et cetera, so that people who are attending the conference do get that quick video on how to do it.
Question. You have a question from Amy Lindner. She's curious if there's a pre-verification method to speed up entry.
Amy, that's a great question. And I think the short answer is yes, but with a little bit of work. So you can share your file ahead of time. So we've seen airlines consider this, where if you decide to share your file with somebody, essentially, you wouldn't share your entire medical record, but you would share your vaccination data, i.e. when you got it, who you are, et cetera, and you can send that to somebody, so that if you had a system either via email that you could intake it, or you know, a profile that they can do an upload to, depending on the type of organization you are, they can send that ahead of time. It might not make sense for all types of events, but it could make sense for those specific use cases. And we can share a little bit more from folks who are probably more technically oriented than Lad and I on exactly how that would work, but it is possible to do so.
It would take some organization and development with the organization itself, and we have thought about different ways where that could happen, and have reached out again to some of these national use case examples, and are working through with them what that might look like. Another question we have heard, by the way, is what if I, as a patient, didn't get vaccinated at my health system? Would the vaccination information be in my record? So in other words, many of us, myself and Bo included, got vaccinated at places other than their primary care advisor provider. And in my instance, I was at an employee vaccination clinic in Bose. He was at a Walgreens. And all of those providers are required to input their information in to the state IAS system. In Wisconsin's instance, that's called WIR, W-I-R. And what we have done from a development perspective is you go into your MyChart account and go to your COVID section. And if your vaccination information doesn't appear there, there is a button that you can push to query the state IAS system, and that will pull the information into your medical record. So we've developed a pathway to pull that information in. And again, because not everyone got vaccinated at their primary provider, we're hopeful that that will increase the utility of the functionality.
Have you guys, have you bumped into any negativity, and how are you responding to it? If there's any.
So we did some careful reach out, especially in Washington, to both members of both political parties. And, just knowing that there are some people who believe that vaccine mandates are an important public health approach, and others who believe that that is not the interest of the government to be mandating anything. And how we have tried to explain this is we are providing a tool that will give businesses and local governments options to consider. And I think, generally speaking, that has been well received. When it moves towards a mandate, that's where the sensitivities get stronger. But how we have been presenting this is an option for businesses to consider, and also for individuals to better control the settings that they choose to go into. The San Francisco Bar Owners Association that we referenced that is doing this, their messaging, and we have not been carefully, for whatever reason, we have not really worked with them on messaging. But they've just kind of organically developed this. And the main reason that they are doing it is for their employees. So what they were indicating is their employees were getting sick, they've got a labor shortage, and we're having a hard time replacing them. So that's been the messaging from the San Francisco Bar Owners Association. But that, Greg, has been, I think, where the sensitivity has been is, is this a mandate or not? And we've really described this as an option or a tool.
I don't see any other questions. Anything else? I don't know if you guys have anything else you want to say before I wrap it up.
Well, Greg, thank you for hosting this and for everyone that has participated. Please, feel free to reach out to us on this issue. Again, we're looking for use cases, so we'd love to talk to folks about any ideas that they have. And then I would, just say additionally, just broader than this credential, as I mentioned, Epic has recently launched this public policy, public affairs function. Please take this as an extended hand. If we can ever be helpful in other ways, always happy to talk and collaborate with other members of the Wisconsin community. So thank you for having us.
Thank you. Hey, by the way, one other last question, then I'll wrap it up. And that is my chart going to prompt to put the credential in? Am I going to get hey, you have a message from my chart? Because I get those, personally, I get them. So maybe a strategy.
Yeah. So that will be a provider decision to make. And I think here in Madison, which is really the first location where we're doing a pronounced rollout, that will be something the providers will be doing in a coordinated way once everyone is in our community, in the Madison community is live. But that is possible to do.
I figured. Okay. Well, thank you both, Lad and Bo, for joining us today, especially at such short notice. Epic's done tremendous work. You're a great asset to our state. We appreciate your leadership in creating an accessible tool. With regulations and requirements popping up, this may be an efficient and reliable way to ensure a safe environment for everybody. If any members, to Lad's point, if anybody's interested in learning more or partnering with Epic on a regional rollout, contact Heather at the GMC and she can connect you guys. And with that, the meeting is adjourned. Thanks, everybody.